Hello everyone, I am Dr. Masood Khan with topic of discussion today cranial nerve examination from Harrison's Manual of Medicine. The bare minimum is check the fundi, visual fields, pupil size and reactivity, extraocular movements and facial movements. For cranial nerve, first cranial nerve, occlude each nostril sequentially and ask patient to gently sniff and identify a mild taste stimulus such as toothpaste or coffee. For second cranial nerve, check visual acuity with eyeglasses or contact lens correction using a Snellen chart or similar tool. Map the visual fields by confrontation testing in each quadrant of visual field for each eye individually. The best method is to sit facing patient 2 to 3 feet apart and then have patient cover one eye gently and fix uncovered eye on examiner's nose. A small white object, for example a cotton-tipped applicator, is then moved slowly from periphery of field toward center until seen. Patient's visual field should be mapped against examiners for comparison. Formal perimetry and tangent screen examination are essential to identify small defects. Optic fundi should be examined with an ophthalmoscope and the color, size and degree of swelling or elevation of the optic disc recorded. The retinal vessels should be checked for size, regularity, AV malformation, AV nipping at cross points. The retinal vessels should be checked for hemorrhage, exudates and aneurysm. The retina, including the macula, should be examined for abnormal pigmentation and other lesions. Cranial nerve 3, 4 and 6 describe size, regularity and shape of pupils. Reaction, direct and consensual to light, and convergence, patient follows an object as it moves closer. Check for lid drooping, lid lag or retraction. Ask patient to follow your finger and report any double vision as you move it horizontally to left and right and vertically with each eye, first fully adducted then fully abducted. Check for failure to move fully in particular directions and for presence of regular rhythmic involuntary oscillations of eye, that is nystagmus. Test quick voluntary eye movements, that is saccades, as well as pursuit, for example follow the finger. The fifth cranial nerve, feel the masseter and temporalis muscles as patient bites down and test jaw opening, protrusion and lateral motion against resistance. Examine sensation over entire face. Testing of the corneal reflex is indicated when suggested by the history. Seventh cranial nerve, look for asymmetry of face at rest and with spontaneous movements. Test eyebrow elevation, forehead wrinkling, eye closure, smiling, frowning. Check puff, whistle, lip pursing and chin muscle contractions. Observe for differences in strength of lower and upper facial muscles. Taste on the anterior two-thirds of tongue can be affected by lesions of the seventh cranial nerve proximal to the chorda tympani. Eighth cranial nerve, check ability to hear tuning fork, finger rub, watch tick, and whispered voice at specific distances with each ear. Check for air versus mastoid bone conduction, that is Rainey's test, and lateralization of a tuning fork placed on center of forehead, that is Weber test. Accurate quantitative testing of hearing requires formal audiometry. Remember to examine tympanic membrane in 8th cranial nerve examination. The 9th and 10th cranial nerve examination includes checking for symmetric elevation of palate uvula with phonation aha, as well as position of uvula and palatal arch at rest. Sensation in region of tonsils, posterior pharynx and tongue may also require testing. Pharyngeal gag reflex is evaluated by stimulating posterior pharyngeal wall on each side with a blunt object, for example, the tongue blade. Direct examination of vocal cords by laryngoscopy is necessary in some situations. The 11th cranial nerve, check shoulder shrug, that is trapezius muscle, and head rotation to each side, sternocleidomastoid muscle against resistance. The 12th cranial nerve examination includes bulk and power of tongue. Look for atrophy, deviation from midline with protrusion, tremor in the tongue, and small flickering or twitching movements, that is fasciculation of the tongue. Thank you very much.